If you've noticed that firmness fades faster than it used to, or that sensitivity isn't what it was even a year ago, the problem might not be your age. It's likely friction damage you've been causing without knowing it. I'm Dr. Mei Anderson, and in the next 13 minutes, I'm going to walk you through a lubrication technique that most urologists never discuss with their patients, but that I've seen restore responsiveness in men who thought their best years were behind them. This has nothing to do with pills, pumps, or procedures, and the first oil I'm going to reveal costs less than $5. Here's what's actually happening during solo sessions after 60. Your skin is producing about 60% less natural lubrication than it did at 40. That means every time you engage in any intimate activity without proper external lubrication, you're creating microscopic tears in the tissue. Tears that accumulate over months and years. These aren't visible to the naked eye, but they're why sensitivity decreases, why firmness doesn't last as long, and why recovery takes longer between sessions. The medical term is cumulative friction trauma, and it's one of the most overlooked causes of age-related sexual decline. But here's the part that matters most. It's completely reversible with the right oil protocol. And I'm going to give you that exact protocol before this video ends. 25 years ago, when I started in urology, I noticed something troubling. Men over 60 would come into my office with sensitivity loss, reduced firmness, and sometimes even painful irritation. But when I asked about their lubrication habits, most said they used nothing, or they used whatever soap was nearby, or cheap drugstore lotions filled with glycerin and alcohol. These products were making things worse, not better. I started researching which natural oils could not only protect tissue, but actually improve blood flow when absorbed through the skin. What I found changed how I counsel every patient over 50. And the results, men reporting firmer, longer-lasting responses within weeks, convinced me this needed to be standard guidance for every man entering his 60s, not a footnote buried in medical literature that nobody reads. Let me be direct about what happens if you continue without proper lubrication, because this matters more than most men realize. First, nerve endings become desensitized. You might think you're just getting older, but you're actually damaging the fine nerve fibers responsible for pleasure. This leads to needing more stimulation to feel anything, which causes more friction, which causes more damage. It's a vicious cycle that accelerates with every month you ignore it. Second, the tissue itself becomes less elastic. Collagen production drops naturally with age, but friction accelerates that breakdown. What used to bounce back now develops microscar tissue that reduces both sensitivity and blood flow capacity. Third, and this is what most men don't connect, poor tissue health directly affects firmness quality. Damaged blood vessels can't dilate properly, meaning firmness is weaker from the start and fades faster during activity. Think about it this way. Every session without proper lubrication is like rubbing sandpaper against delicate tissue. You wouldn't do that to any other part of your body, yet that's essentially what's happening when you skip lubrication or use the wrong products. The cumulative effect over years is devastating. I've seen men lose years of function because they thought lubrication was optional or indulgent. It's not. It's preventive medicine for intimate tissue health, and it should be treated with the same importance as cardiovascular exercise or dental care. Let me tell you about Donald, not his real name, but his story represents dozens of men I've worked with. Donald came to me at 67, visibly frustrated because intimacy with his wife had become uncomfortable and unsatisfying. He'd lost confidence, started avoiding situations that might lead to intimacy, and felt too embarrassed to even bring it up with his regular doctor. When I asked about his routine during solo sessions, he admitted he'd been using hand lotion, just to get it over with quickly. That lotion contained both alcohol and synthetic fragrance, two ingredients that were actively drying out and irritating his tissue with every use. I put Donald on a simple protocol that day. Pure coconut oil, applied 10 minutes before any activity, with a focus on letting it absorb slightly into the skin rather than just sitting on the surface. Within 3 weeks, he called my office. I didn't know I could still feel like this, he told me. His sensitivity had improved noticeably. Firmness lasted longer than it had in years, and the irritation that had become his normal was completely gone. We'll come back to Donald's full results in just a few minutes, but his case taught me something crucial. Most men are unknowingly sabotaging themselves with the wrong products, and they have no idea how much function they could reclaim with one simple change. Here's the biology behind why natural oils work better than store-bought lubricants, and I promise to keep this simple. Your penile skin has two layers that matter here: the epidermis on the outside and the dermis underneath. Commercial water-based lubes sit on top of the epidermis and evaporate within minutes. They provide temporary slickness, but deliver zero benefit to the actual tissue. Oil-based lubrication, specifically cold-pressed plant oils, does something completely different. The fatty acid molecules in these oils are small enough to penetrate into the upper dermis, where they deliver vitamins, antioxidants, and compounds that improve both elasticity and blood vessel function. A 2019 study in the Journal of Sexual Medicine found that topical application of vitamin E, which is abundant in almond and argan oils, improved penile tissue elasticity in men over 60 by 34% after just 8 weeks of regular use. That's not a small improvement. That's the kind of change that translates to noticeable differences in how you feel and perform. The oils I'm about to recommend also contain medium-chain triglycerides, which multiple studies have shown enhance local circulation when absorbed through the skin. Better circulation means better firmness, longer duration, and faster recovery between sessions. Think of it this way. Water-based lubes are like pouring water on dry soil. It runs off the surface and provides no lasting benefit. Oil is like adding nutrient-rich compost. It absorbs into the soil, feeds the roots, and creates lasting improvement. That's the difference we're talking about here. One provides temporary relief, the other actually heals and strengthens the tissue over time. Now, before I give you the specific oils and the exact protocol, I want you to know that everything I'm covering here is just the foundation. I've compiled years of clinical research, patient protocols, and advanced techniques into something called the Complete Sexual Health Blueprint for Men over 50. It goes far deeper than what we can cover in one video, including circulation exercises, hormone optimization strategies, and prostate-safe practices that most men never learn about. There's a link in the description below, and I'd encourage you to grab that resource while it's still available. It's designed to give you the complete system, not just one piece of the puzzle. But what I'm giving you right now will absolutely make a difference on its own, so let's get into the specifics. Alright, here's the exact protocol I give my patients. You only need one of these oils to start, but I'll give you 3 options based on your specific needs, and you can choose whichever makes the most sense for your situation. Option 1. Virgin coconut oil, your all-rounder. If you want one oil that handles everything, lubrication, tissue protection, and antimicrobial benefits, coconut oil is it. It contains lauric acid, which naturally prevents bacterial and fungal infections, and medium-chain triglycerides that improve blood flow to the area when absorbed. Use organic, unrefined coconut oil. You'll find it at any grocery store for about $8, and that jar will last you months. Here's how to use it. Take about a teaspoon, warm it between your hands until it melts. It solidifies at room temperature but melts instantly with body heat, and then apply it generously to the entire shaft and head. The key step most men skip is this. Apply it 10 minutes before any activity. Don't just slap it on, and immediately start. Those 10 minutes allow partial absorption into the tissue, which is where the real benefits happen. The surface stays slick for lubrication, but the deeper layers are getting nourishment and circulation support. This absorption phase is critical. Without it, you're just getting surface lubrication. With it, you're actually improving tissue health with every application. Option 2. Sweet almond oil, the sensitivity restorer. If your main complaint is reduced sensation or numbness that's developed over the years, almond oil is your best choice. It's incredibly rich in vitamin E and omega-3 fatty acids that specifically repair nerve endings in the skin. It's lighter than coconut oil, absorbs faster, and men consistently report noticeable sensitivity improvements within 2 to 3 weeks of regular use. Same application method. Warm it between your hands, apply generously, and wait 10 minutes before activity. One patient told me that after a month on almond oil, he could feel textures and sensations he hadn't experienced in over a decade. He described it as rediscovering pleasure he thought was gone forever. That's the power of giving damaged nerves the nutrients they need to heal. The B vitamins in almond oil, particularly riboflavin and niacin, support nerve function at a cellular level. You're not just lubricating, you're actively repairing nerve pathways that have been damaged by years of inadequate care. Option 3. Jojoba oil, the skin healer. If you deal with chronic dryness, irritation, or skin that just feels thin and fragile, jojoba oil is uniquely suited to your needs. Here's what makes it special. Jojoba is technically a liquid wax, not an oil, and its molecular structure is almost identical to human sebum, the natural oil your skin produces. Your skin recognizes jojoba and absorbs it deeply, using it to repair the moisture barrier and restore elasticity. It's also the least likely of any oil to cause allergic reactions, making it perfect for men with sensitive skin or a history of irritation. And unlike most oils, jojoba doesn't go rancid, so you can keep a bottle by your bed for months without any concern about it spoiling. This is particularly convenient for men who want a grab-and-go option without worrying about storage or expiration. Jojoba also contains zinc and copper, trace minerals that are essential for tissue repair and collagen production. These minerals don't just sit on the surface. They're absorbed and used by your body to strengthen and heal the skin from within. Here's the most important instruction. Regardless of which oil you choose, commit to using it for 30 days straight. Apply it every single time. Not just when you remember or when you feel like it. The benefits are cumulative. Your tissue needs consistent care to repair years of accumulated damage. Think of it like physical therapy for intimate tissue. One session helps, but consistent application over weeks creates lasting transformation. And yes, if you want to take it to the next level, you can combine oils. Half jojoba and half almond is an excellent combination that gives you both deep skin healing and nerve repair. Some of my patients who are serious about optimization use that blend, and the results speak for themselves. Another powerful combination is coconut oil, with a few drops of vitamin E oil squeezed from a capsule. This creates an intensive repair formula that addresses both protection and regeneration simultaneously. Let's check back in with Donald, because his story doesn't end at 3 weeks. After 6 weeks of consistent coconut oil use, he told me something that made him emotional during our follow-up appointment. His wife had noticed the difference before he'd said a single word about what he was doing. She asked what I was doing differently, he said, laughing. She said I seemed more confident, more present. His firmness was lasting significantly longer. His sensitivity had returned to levels he hadn't experienced in years, and the psychological burden of avoiding intimacy had lifted completely. They'd reconnected in a way they hadn't since their 50s. That's what proper tissue care can do. It's not just physical, it's emotional and relational. When you feel confident in your body's responsiveness, that confidence extends into every aspect of intimacy. Donald told me he'd stopped making excuses, stopped feeling anxious about whether things would work, and started actually enjoying intimate moments again. And it all started with something as simple as the right oil applied the right way. Donald isn't an isolated case. I've had countless patients tell me they thought decline was just how it is now, until they tried this protocol and realized how much they'd been accepting unnecessarily. One man, 72 years old, told me his firmness used to last maybe a minute before starting to fade. After 8 weeks with almond oil, he reported 10 to 15 minutes of sustained firmness without any loss of quality. That's a dramatic improvement that completely changed his intimate life and his relationship with his partner. Another patient had been dealing with painful irritation after every session. Turned out he was using scented lotion that contained alcohol and artificial fragrance. He switched to jojoba oil, and the irritation was gone within 3 days. He couldn't believe something so simple had been the solution all along. These aren't miracles or exaggerations. This is basic tissue care that should be standard advice for every man over 60, but it's not taught in medical schools and most doctors don't discuss it because it's not a prescription they can write. But it works, and the evidence is in the results my patients experience week after week. Now, if you're thinking this sounds too simple to make a real difference, I understand that skepticism. We're conditioned to believe that real solutions require prescriptions, procedures, or expensive interventions. But the truth is that your body has an incredible capacity to heal and restore function when you give it the right tools. Skin cells regenerate every 28 days. Nerve endings can repair themselves when inflammation is reduced and proper nutrients are present. Blood vessels can regain elasticity when they're not constantly subjected to friction damage. The oil protocol I've just given you addresses all three of those factors simultaneously. You're reducing friction, delivering nutrients, and supporting circulation, all with one simple habit change. This is foundational care that sets the stage for everything else. If you want to go deeper, and I recommend you do, the Complete Sexual Health Blueprint covers advanced protocols that build on this foundation. It includes pelvic floor exercises that increase blood flow by up to 40%, dietary strategies that support natural testosterone production, and timing techniques that extend duration without any medication. That resource is linked in the description, and it's designed to work synergistically with what you're learning here. I want to remind you that everything we've covered here is part of a much larger framework for sexual health and vitality after 50. The blueprint I mentioned includes detailed protocols for pelvic floor strengthening, dietary strategies that support hormone production, and specific exercises that increase blood flow to the pelvic region better than anything else I've seen in 25 years of practice. If you're serious about reclaiming and maintaining function well into your 70s and 80s, that resource will give you the complete roadmap. The link is in the description, and I genuinely encourage you to grab it before we take it down. But even if you just implement what I've given you today, choosing one oil, applying it consistently, giving it 30 days, you will see measurable improvement. I've seen it happen too many times to doubt it. Here's what I need you to do right now. First, if you don't want to lose more sensitivity or function to preventable friction damage, subscribe to this channel. I release videos every single week on sexual health strategies for men over 60 that your regular doctor won't discuss. Things like circulation boosters, hormone optimization without prescriptions, and prostate-safe techniques that preserve function instead of compromising it. Don't let another year go by thinking decline is inevitable, when it's often just poor information or overlooked solutions. Hit that subscribe button so you don't miss what's coming next. Second, click the like button and share this video with any man you know who might be struggling silently with these issues. Sexual health affects confidence, relationships, and overall quality of life, and most men over 60 think they just have to accept decline as normal aging. They don't, and you don't. You're potentially helping someone get years of function back, just by sharing this video. That's worth the 2 seconds it takes to hit the share button. Next week, I'm covering the one exercise that increases blood flow to the pelvic region better than anything else. It takes 3 minutes a day, requires zero equipment, and the measurable results start showing up in 10 to 14 days. You won't find this information in generic fitness channels or mainstream health content. This is specific, clinical, evidence-based guidance for men over 60 who want to maintain or restore sexual function naturally. Click the notification bell so you don't miss it. I've been Dr. Mei Anderson. Thank you for trusting me with 13 minutes of your time. If you implement what I've shared today, choose your oil, commit to 30 days, apply it correctly, I'm confident you'll see the kind of improvement that makes you wonder why nobody told you this years ago. I'll see you in the next video.